Have you ever wondered what the single most important thing you should be doing each year if you're over 65 here in the US? It's not just about taking your medications or the occasional doctor's visit for when you're feeling unwell. This video dives deep into the essential annual practice that doctors overwhelmingly recommend to keep you healthy, active, and thriving in your golden years. You need to watch until the very end because we'll not only reveal this crucial yearly action but also break down exactly what it entails, why it's so vital for your long-term well-being, and how it can help you catch potential health issues early, stay on top of preventative care, and ultimately enjoy a higher quality of life. Don't miss out on this vital information that could significantly impact your health and happiness. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. The core recommendation: the annual wellness visit with a primary care physician. For individuals aged 65 and older in the United States, healthcare professionals strongly advocate for scheduling and attending an annual wellness visit, AWV, with a primary care physician, PCP. This visit, covered by Medicare Part B, is distinct from a standard physical exam or a visit prompted by illness. Instead, it is a proactive, preventive, and comprehensive appointment designed to promote healthy aging, detect potential health issues early, and optimize overall well-being. Below is an in-depth exploration of the purpose, components, and benefits of the annual wellness visit, tailored to the needs of older adults. Purpose of the annual wellness visit. The AWV is a cornerstone of preventive healthcare for seniors, offering a structured opportunity to assess and address the unique health needs of individuals over 65. Unlike acute care visits focused on specific complaints, the AWV emphasizes prevention, early detection, and personalized health planning. Its primary goals include holistic health evaluation, to review and document changes in health status, medical history, and lifestyle factors that influence long-term well-being. Chronic disease management, to monitor and optimize the management of chronic conditions that are common in older adults. Risk identification and mitigation, to identify potential health risks, such as falls, cognitive decline, or medication-related issues, and implement strategies to address them. Preventive care coordination, to ensure patients receive recommended screenings, vaccinations, and counseling to prevent serious health conditions. Future planning, to discuss and document preferences for future medical care, including advance directives. By focusing on these areas, the AWV empowers older adults to maintain independence, improve quality of life, and reduce the likelihood of preventable hospitalizations or complications. Key components of the annual wellness visit. The AWV is a comprehensive and structured appointment that covers a union of several critical elements, each designed to provide a thorough assessment of health and well-being. Below is a detailed breakdown of the key components. 1. Comprehensive review of health and medical history. During the AWV, the primary care physician will conduct a thorough review of the patient's health status and medical history. This includes updates to medical history, documenting any new diagnoses, hospitalizations, surgeries, or significant health events since the last visit. Symptom review, discussing new or worsening symptoms, such as fatigue, pain, shortness of breath, or changes in appetite, which may indicate underlying issues. Family history update, reviewing family medical history, as genetic predispositions to conditions like heart disease, cancer, or dementia may influence screening recommendations. Social and lifestyle factors, assessing social determinants of health, such as living situation, support systems, and access to food and transportation, which can impact health outcomes. This detailed review helps the physician create a personalized health profile, enabling early identification of potential health risks and the development of tailored interventions. 2. Management of chronic conditions. Chronic conditions such as diabetes, hypertension, heart disease, arthritis, chronic obstructive pulmonary disease, COPD, or kidney disease are prevalent among older adults. The AWV provides a dedicated opportunity to monitor disease progression, assess how well chronic conditions are controlled through clinical measurements, e.g., blood pressure, blood glucose levels, and patient-reported symptoms. Adjust treatment plans, modify medications, dosages, or therapies based on current health status, side effects, or changes in guidelines. Coordinate care. Ensure collaboration with specialists, e.g., cardiologists, endocrinologists, to optimize management of complex conditions. Educate patients. Guide self-management strategies, such as monitoring blood sugar or adhering to a low-sodium diet. Effective chronic disease management during the AWV can prevent complications, reduce hospitalizations, and improve quality of life. 3. Medication reconciliation. Older adults often take multiple medications, including prescriptions, over-the-counter, OTC drugs, and supplements. Polypharmacy, the use of multiple medications, increases the risk of adverse drug interactions, side effects, and medication errors. During the AWV, the physician will review all medications, compile a complete list of medications, including dosages, frequency, and indications. Assess necessity. Determine whether each medication is still necessary, particularly for drugs prescribed years ago that may no longer be appropriate. Check for interactions. Identify potential drug-drug or drug-supplement interactions that could cause harm, such as increased bleeding risk or reduced drug efficacy. Simplify regimens. Where possible, streamline medication regimens to improve adherence and reduce the risk of errors. Address side effects. Discuss any side effects, e.g., dizziness, fatigue, and explore alternative medications or non-pharmacologic options. Medication reconciliation is critical for ensuring safety and efficacy, particularly given the physiological changes associated with aging, such as reduced kidney or liver function. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. 4. Preventive screenings and vaccinations. Preventive care is a cornerstone of the AWV, focusing on early detection of diseases and protection against preventable infections. The physician will recommend and often facilitate age-appropriate screenings and vaccinations, tailored to the patient's risk factors, medical history, and current guidelines. Key vaccinations. Influenza, flu, vaccine. Recommended annually, ideally in the fall, to protect against seasonal influenza. Older adults are at higher risk of severe complications, such as pneumonia or hospitalization. High-dose or adjuvant flu vaccines, e.g., Fluzone High-Dose or Fluad, are often recommended for adults over 65 due to their enhanced immune response. Pneumococcal vaccine protects against pneumonia, meningitis, and bacteremia caused by Streptococcus pneumoniae. 2 vaccines are commonly used. PCV20, Prevnar 20, a single-dose vaccine that covers 20 strains, often sufficient for most adults over 65. PPSV23, Pneumovax 23 may be recommended in specific cases, such as for individuals with certain chronic conditions or a history of prior vaccination. The physician will review vaccination history and risk factors to determine the appropriate schedule. Tetanus, diphtheria, and pertussis, TAP or TD booster. Recommended every 10 years to maintain immunity against tetanus, diphtheria, and pertussis, whooping cough. A one-time TAP dose is often prioritized to protect against pertussis, followed by TD boosters. Shingles vaccine, Zoster vaccine recombinant. Shingrix, a 2-dose series recommended for adults over 50 to prevent shingles and its complications, such as postherpetic neuralgia, chronic pain. Shingles is caused by reactivation of the varicella-zoster virus, and the risk increases with age. Other vaccines. Depending on individual risk factors, additional vaccines such as the RSV vaccine for respiratory syncytial virus or COVID-19 boosters may be recommended, particularly for those with chronic conditions or living in communal settings. Key screenings. Colorectal cancer screening, essential for early detection of colorectal cancer, which is highly treatable when caught early. Options include colonoscopy, recommended every 10 years for average-risk individuals, starting at age 45 or 50 and continuing through age 75. Frequency may increase for those with polyps or higher risk. Sigmoidoscopy, every 5 years, often combined with stool-based tests. Stool-based tests, such as fecal immunochemical tests, FIT, or multi-target stool DNA tests, e.g., Cologuard, recommended annually or every 3 years, respectively. Screening decisions after age 75 are individualized based on life expectancy and overall health. Breast cancer screening. 4 women mammograms are recommended annually or biennially for women aged 50 to 74, with guidelines varying by organization, e.g., American Cancer Society versus USPSTF. For women over 75, screening decisions are based on individual health status and life expectancy. Additional imaging, such as breast ultrasound or MRI, may be recommended for those with dense breasts or higher risk. Prostate cancer screening. For men, screening typically involves a prostate-specific antigen, PSA, blood test, and, in some cases, a digital rectal exam, DRE. The decision to screen is highly individualized, as PSA screening has both benefits, early detection, and risks, overdiagnosis, unnecessary procedures. Men aged 55 to 69 with average risk, and those over 70 with higher risk, e.g., family history, African American descent, should discuss screening with their physician. Bone density scan, DEXA scan recommended for women aged 65 and older should be screened for osteoporosis, a condition that increases fracture risk. Men aged 70 and older, or younger men with risk factors, e.g., long-term steroid use, low body weight. Individuals with a history of fragility fractures or significant risk factors. The scan measures bone mineral density and is typically repeated every 2 to 5 years, depending on results. Abdominal aortic aneurysm, AAA screening. A one-time ultrasound is recommended for men aged 65 to 75 who have ever smoked, as smoking significantly increases the risk of AAA, a potentially life-threatening condition. Screening may also be considered for men or women with a family history of AAA. Vision and hearing assessments. While comprehensive eye exams, with an ophthalmologist or optometrist, and hearing evaluations, with an audiologist, are ideal, the PCP may perform basic assessments during the AWV. These may include vision testing, using a Snellen chart to detect changes in visual acuity or conditions like cataracts, glaucoma, or macular degeneration. Hearing screening, asking about hearing difficulties or performing a whisper test to identify hearing loss, which is common in older adults and can affect quality of life. Referrals to specialists are made if abnormalities are detected. Lung cancer screening. For individuals aged 50 to 80 with a significant smoking history, e.g., 20 pack years, and who currently smoke or quit within the past 15 years, low-dose CT scans are recommended annually. This screening is critical for early detection of lung cancer, which is often asymptomatic in its early stages. Cardiovascular risk assessment. The physician may calculate a 10-year cardiovascular risk score using factors like age, blood pressure, cholesterol levels, and smoking status. This informs recommendations for lifestyle changes, statins, or aspirin therapy. Diabetes screening. For individuals with risk factors, e.g., obesity, family history, screening may involve fasting glucose, HbA1c, or oral glucose tolerance tests, typically every 3 years or more frequently if abnormal. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. 5. Assessment of functional status and fall risk. Falls are a leading cause of injury and disability among older adults, contributing to fractures, head injuries, and loss of independence. During the AWV, the physician will evaluate mobility and balance, perform tests such as the Timed Up and Go (TUG) test or assess gait to identify instability. Review fall history. Ask about recent falls or near falls, as even minor incidents can indicate risk. Assess home safety. Discuss environmental hazards, e.g., loose rugs, poor lighting, and recommend modifications. Screen for contributing factors. Identify conditions like orthostatic hypotension, vision impairment, or muscle weakness that increase fall risk. Recommend interventions. Suggest physical therapy, balance exercises, e.g., Tai Chi, assistive devices, e.g., canes, walkers, or home safety evaluations by an occupational therapist. Preventing falls is critical for maintaining independence and avoiding costly hospitalizations. 6. Mental health and cognitive screening. Mental health and cognitive function are integral to overall well-being, yet conditions like depression, anxiety, and cognitive impairment are often underdiagnosed in older adults. The AWV includes depression screening, using tools like the Patient Health Questionnaire 2, PHQ-2, or PHQ-9 to assess symptoms of depression, such as low mood or loss of interest in activities. Anxiety screening, asking about excessive worry, restlessness, or panic symptoms, which may be triggered by life changes or medical conditions. Cognitive assessment, performing brief tests like the Minicog or Montreal Cognitive Assessment, MoCA, to screen for mild cognitive impairment, MCI, or early dementia. These tests evaluate memory, attention, and executive function. Substance use screening, asking about alcohol, tobacco, or prescription medication misuse, as these can exacerbate mental health or cognitive issues. If abnormalities are detected, the physician may recommend counseling, medication, or referrals to psychiatrists, psychologists, or neurologists. 7. Lifestyle counseling. Healthy lifestyle choices are critical for preventing disease and promoting longevity. The AWV includes personalized counseling on nutrition, recommending a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Specific guidance may address conditions like hypertension, e.g., DASH diet, or diabetes, e.g., carbohydrate counting. Physical activity, encouraging at least 150 minutes of moderate aerobic activity per week, e.g., brisk walking, swimming, and strength training twice weekly, tailored to the patient's fitness level and mobility. Sleep hygiene, addressing sleep disturbances, which are common in older adults, with strategies like maintaining a consistent sleep schedule or avoiding caffeine late in the day. Stress management, suggesting techniques such as mindfulness, meditation, or social engagement to reduce stress and improve mental health. Smoking cessation, offering resources, e.g., counseling, nicotine replacement therapy, for patients who smoke, as quitting at any age improves health outcomes. Alcohol moderation, advising limits of 1 drink per day for women and 2 for men, and cautioning about interactions with medications. Lifestyle counseling empowers patients to take an active role in their health and prevent chronic diseases. 8. Advanced care planning. The AWV provides a valuable opportunity to discuss advanced care planning, ensuring that patients' preferences for future medical care are documented and respected. This includes advanced directives, creating or updating documents like a living will, specifying desired medical interventions, and a durable power of attorney for healthcare, designating a trusted decision-maker. Goals of care discussions, exploring preferences for life-sustaining treatments, such as CPR, mechanical ventilation, or tube feeding, in the context of the patient's values and prognosis. Palliative and hospice care, explaining options for symptom-focused care or end-of-life support, particularly for those with serious illnesses. Documentation, ensuring that advanced directives are accessible in the medical record and shared with family members or healthcare proxies. These discussions promote patient autonomy and reduce the burden on families during medical crises. If you are still watching this video and finding these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Thank you for your valuable time. 9. Personalized health risk assessment and plan. After the AWV, the physician will provide a personalized health risk assessment and a preventive care plan. This includes summary of findings, highlighting key health risks identified during the visit, such as elevated blood pressure or low bone density. Recommended actions, outlining specific steps, such as scheduling a colonoscopy, starting an exercise program, or adjusting medications. Follow-up plan, scheduling the next AWV, typically in 12 months, and any interim visits for chronic disease management or specialist referrals. Patient education materials, providing resources on topics like fall prevention, vaccine schedules, or healthy eating. This personalized plan serves as a roadmap for maintaining health and addressing risks over the coming year. Why the annual wellness visit matters. The AWV is a powerful tool for healthy aging, offering numerous benefits for older adults, their families, and the healthcare system. Early detection, identifying health issues before they become severe, such as prediabetes, early-stage cancer, or cognitive decline. Improved disease management, optimizing control of chronic conditions, reducing complications, and enhancing quality of life. Prevention of serious illness. Vaccinations and screenings prevent or mitigate conditions like influenza, pneumonia, or colorectal cancer. Cost savings. Preventive care reduces the need for expensive hospitalizations, emergency visits, or long-term care. Empowerment. Equipping patients with knowledge and resources to make informed health decisions. Longevity and independence. Supporting physical, mental, and functional health to promote a longer, more active life. For Medicare beneficiaries, the AWV is fully covered with no out-of-pocket costs, making it an accessible and cost-effective opportunity to invest in health. How to prepare for the annual wellness visit. To maximize the benefits of the AWV, patients can take the following steps. Compile a medication list. Bring a complete list of all prescriptions, OTC drugs, and supplements, including dosages and frequencies. Note health changes. Jot down any new symptoms, falls, or changes in mood, sleep, or appetite since the last visit. Review family history. Update information about family members' health conditions, particularly cancer, heart disease, or dementia. Prepare questions. Write down questions about screenings, vaccinations, or health concerns to discuss with the physician. Bring records. If care was received from other providers, e.g., specialists, urgent care, bring relevant records or summaries. Consider advanced care preferences. Reflect on values and goals for future medical care to guide discussions about advanced directives. Arriving prepared ensures a productive visit and helps the physician tailor recommendations to the patient's needs. Special considerations for older adults. The AWV is designed to address the unique needs of older adults who face distinct health challenges. Age-related changes, declines in kidney function, muscle mass, or immune response may affect medication dosing, fall risk, or vaccine efficacy. Multimorbidity. Many older adults manage multiple chronic conditions, requiring careful coordination of care and medications. Social isolation. Loneliness and limited social support can exacerbate mental health issues and affect adherence to medical recommendations. Caregiver involvement. For patients with cognitive impairment or complex needs, involving a family member or caregiver in the AWV can enhance communication and follow-through. Health equity. Disparities in access to care, language barriers, or cultural preferences may influence how the AWV is delivered. Physicians should use interpreters or culturally sensitive approaches as needed. Beyond the annual wellness visit. While the AWV is a critical component of preventive care, it complements other aspects of healthcare for older adults. Specialist care. Regular visits to specialists, e.g., cardiologists, rheumatologists, for complex conditions. Comprehensive eye exams. Annual or biennial exams with an ophthalmologist or optometrist to detect glaucoma, cataracts, or macular degeneration. Dental care. Regular dental visits to prevent oral health issues, which can affect nutrition and systemic health. Community resources. Engaging with senior centers, exercise programs, or nutrition services, e.g., Meals on Wheels, to support overall well-being. Follow-up visits. Addressing acute issues or monitoring chronic conditions between AWVs. By integrating the AWV with these elements, older adults can build a robust framework for healthy aging. If you are still watching this video and finding these lessons useful, please comment number 4 below to let me know that you are still watching this video with me. Thank you for your valuable time. 1. Early detection of age-related diseases and conditions. As individuals age, they become more susceptible to a variety of health conditions, such as cardiovascular disease, diabetes, osteoporosis, arthritis, cancer, and cognitive disorders like dementia. Many of these conditions develop slowly and may not present noticeable symptoms in their early stages. Annual visits provide an opportunity for healthcare providers to conduct comprehensive screenings and diagnostic tests tailored to the needs of older adults. For example, blood tests can detect abnormalities in cholesterol levels, blood sugar, or kidney function, which may indicate the onset of diabetes or heart disease. Cancer screenings, such as mammograms, colonoscopies, or prostate exams, can identify malignancies at an early, more treatable stage. Bone density tests can diagnose osteoporosis before a fracture occurs. Cognitive assessments can identify early signs of memory loss or dementia, allowing for interventions to slow progression. By catching these conditions early, healthcare providers can implement treatments or lifestyle changes that may prevent or delay serious complications, significantly improving outcomes. Early detection is especially critical for older adults, as their bodies may be less resilient to advanced disease, and timely intervention can make a substantial difference in prognosis. 2. prevention through vaccinations and lifestyle counseling. Preventive care is a cornerstone of annual visits, particularly for those over 65, who are at higher risk for infections and chronic illnesses. During these visits, healthcare providers assess and update vaccinations, which are essential for protecting against preventable diseases. Key vaccines for older adults include influenza, flu vaccine, administered annually to reduce the risk of severe flu complications, which can be particularly dangerous for seniors. Pneumococcal vaccines protect against pneumonia, a leading cause of hospitalization in older adults. Shingles vaccine reduces the risk of shingles, a painful condition caused by the reactivation of the varicella-zoster virus. COVID-19 boosters help maintain immunity against severe outcomes of the virus, which disproportionately affect older populations. In addition to vaccinations, annual visits provide an opportunity for personalized lifestyle counseling. Healthcare providers can evaluate factors such as diet, physical activity, smoking, and alcohol consumption, offering tailored recommendations to promote health. For instance, nutrition advice can help manage weight, prevent malnutrition, and support conditions like hypertension or diabetes. Exercise plans can improve strength, balance, and mobility, reducing the risk of falls, a major cause of injury in older adults. Mental health screenings can address issues like depression or anxiety, which are common but often underdiagnosed in seniors. By emphasizing prevention, annual visits empower older adults to take proactive steps to maintain their health and avoid serious illnesses. 3. Coordination of care with specialists. Older adults often manage multiple chronic conditions, requiring care from various specialists such as cardiologists, endocrinologists, or neurologists. A primary care physician serves as the central hub for coordinating this care, ensuring that all aspects of a patient's health are addressed holistically. During annual visits, the primary care provider reviews all medications to prevent harmful interactions, adjust dosages, or discontinue unnecessary drugs, a process known as deprescribing, which is particularly important for older adults who may be on multiple medications, polypharmacy. Communicates with specialists to align treatment plans, ensuring that interventions for one condition do not exacerbate another. Updates medical records to maintain a comprehensive overview of the patient's health history, which is critical for informed decision-making. This coordination is especially vital for older adults with complex health needs, as fragmented care can lead to misdiagnosis, conflicting treatments, or gaps in care. By fostering collaboration among healthcare providers, annual visits help create a seamless and effective care plan that addresses the patient's unique needs. 4. Improved quality of life and independence. One of the primary goals of annual visits is to help older adults maintain their independence and enjoy a high quality of life for as long as possible. By proactively managing health issues, these visits can prevent or mitigate complications that might otherwise limit functionality or require long-term care. For example, managing chronic pain from arthritis can improve mobility and allow seniors to engage in daily activities. Controlling blood pressure or blood sugar can prevent strokes or heart attacks, which could lead to disability. Addressing hearing or vision loss through screenings and interventions, e.g., hearing aids or cataract surgery, can enhance social engagement and safety. Moreover, annual visits often include assessments of functional status, such as balance, strength, and cognitive ability. These evaluations can identify areas where support is needed, such as physical therapy to improve mobility or home modifications to prevent falls. By addressing these issues early, healthcare providers can help older adults remain active, socially connected, and independent, which is critical for mental and emotional well-being. 5. Cost-effectiveness and long-term savings. Healthcare costs can be a significant concern for older adults, many of whom live on fixed incomes. Annual visits are a cost-effective strategy because they focus on prevention and early intervention, which can reduce the need for expensive treatments or hospitalizations later. For example, detecting and managing high blood pressure early can prevent a costly hospital stay for a heart attack or stroke. Regular screenings for colorectal cancer can identify precancerous polyps, avoiding the need for invasive cancer treatments. Vaccinations can prevent illnesses like pneumonia, which often lead to prolonged and expensive medical care in older adults. Additionally, many preventive services, such as annual wellness visits and certain screenings, are covered at no cost under Medicare for individuals aged 65 and older. By taking advantage of these services, Older adults can address health issues before they escalate, saving both financial and emotional resources in the long run. Conclusion: annual medical visits are a cornerstone of healthy aging for individuals over 65, offering a proactive approach to managing the unique health challenges of this population. Through early detection, preventive measures, coordinated care, and a focus on quality of life, these visits empower older adults to maintain their health, independence, and well-being. Furthermore, by addressing health issues before they become severe, annual visits can lead to significant cost savings, making them a wise investment in both health and financial security. For older adults, prioritizing these regular checkups is not just a medical necessity but a vital step toward thriving in their later years. So, what key takeaways are resonating with you from everything we've discussed about prioritizing that annual wellness visit? Think about it for a moment. What's one thing you've learned today that you're planning to actively incorporate into your life or discuss with your doctor? We'd love to hear your thoughts. Please share in the comments below one specific thing you've learned from this video and how you intend to put it into practice. If you found this information valuable, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more insightful health and wellness tips.